Welcome back to Living Local. I'm Gail Kvistad, your host, and we're here at Turner Medical Arts down on Garden Street. And you are going to meet Dr. Turner and Lisa. And Lisa's an expert on skincare, and you've seen her on the show before. We're going to check in and find out what's new in female healthcare and rejuvenation.
We're happy to have you here. Welcome.
Thank you. Now, what do you have to show me today?
Oh my goodness, where do I start? We offer a full array of services, everything from women's health issues, rejuvenation, to facial skin rejuvenation, laser hair removal.
And that's why I always come and consult with Lisa, because you are my expert.
Oh yes, oh yes.
We've known each other for years, and you...
Since ninth grade.
Volleyball, go
4 years
Royals.
ago.
Go Royals. So I'm here to find out the latest and greatest that we can do with skincare, because you've told me about the collagenizer facial.
Yes, that's my favorite. Love it, love it.
And so I want to step in and learn a little bit more.
All right, fabulous.
You mentioned the collagenizer and what a fabulous treatment it is, and it's designed to push product down to the dermal layer of your skin using electronic technology. It pushes down those products down to the dermal layer, so you get the maximum benefit.
And that's without an injection.
That's
an
no
actual
injections,
machine.
no microneedling, no downtime. Patients absolutely love it. The full benefits: plumping up the skin, minimizing fine lines and pore size, and it's a really great treatment to combine with a PRP, which...
This is what I want to know about, because we had the vein clinic on years ago, and the platelet-rich plasma and spinning the blood was really important and new, and now it's kind of mainstream. You hear about it everywhere. So how can we do it here? What's happening?
All right. So our DEP and PRP treatments are done by our PA, Sarah Green, who's fabulous, and she'll take a little, I know you don't like needles, but it's a very quick, easy process.
Okay.
She'll take out a little blood, and she'll spin it in a centrifuge to separate the blood from the plasma.
My own blood.
Your own blood, your own plasma. And this treatment that we use the plasma, so you're not getting the bloody face that you've seen previously in advertisements for this type of treatment. It's just plasma. It's gently placed over your face and pushed down into that dermal layer that we talked about. And that way your skin starts to regenerate, your own collagen regenerates, and we're seeing amazing results. Patients are absolutely loving this treatment, and they're coming back and buying package after package after package.
Because it's something you can do that keeps you fresh.
Yes.
And keeps the skin turning over and actually building more collagen.
Yes, maintaining that skin.
Maintaining the skin.
Absolutely.
Exactly.
You gotta work at it from head to toe.
And so what other things do you have? Weight loss, and you have new baby programs. You have a whole wide arrangement of things, right?
Yes, we do have a weight loss program, and if you had a baby and you're no longer breastfeeding and are having a difficult time dropping off that weight, that baby weight, we have a nice comprehensive weight loss program that includes B shots, weekly weigh-ins,
and
medication
it's monitored by the doctor, so it's an actual really safe program.
Yes.
There are some changes that occur that we have never really talked about before, and women are starting to talk more about these issues. And
socially, you're just not talking just here at Turner Arts, but just generally in the universe. People have not spoken.
Having to use the restroom much more than we used to have. Just other issues that affect our intimate relationships. And Dr. Turner is taking care of those challenges and those problems that we are experiencing.
Because he has had the opportunity to deliver a lot of these babies.
He delivered my 26-year-old. Oh. Yes. He's passionate about women's health care, and he's on top of all the cutting edge technology that's available. And he's brought it here to Santa Barbara, and he's starting to inform our health providers, women our age, about the fabulous treatments that there are for some of these issues that we're dealing with. I am so excited for you to meet Dr. Turner.
Oh, so am I. I've heard so much. Hello. I've heard a lot about you, Dr. Turner. It's a pleasure.
It's good to see you.
A lot of you out there might know this doctor because he's delivered a lot of babies here in Santa Barbara, haven't you?
It's been my privilege.
Oh, and it's our privilege to be here today because things have kind of come full circle, and you have rejuvenation for women in addition to new babies.
Absolutely. Women will spend more than half their adult life in menopause, and we've got to keep them going and keep them happy and have good quality of life.
And that's important
So-
because I'm just starting to hear about menopause myself, and I start listening to things and listening to stories and hot flashes and sweats, and it just doesn't sound like a lot of fun.
It's not a lot of fun.
But you have come up with a program to help people.
Yeah, and what we're really trying to do is encourage patients to talk about it, because that's the major issue. They have the problems. 50% of menopausal women have symptoms of what's called genitourinary syndrome of menopause, which is urinary incontinence, urinary frequency, having to get up at night to empty their bladder, and then sexual issues such as pain with intercourse, lack of sensation in other areas, and
You can help remedy this.
and we can fix those.
Those are fixable
Non-surgical,
things. Non-surgical ways.
sometimes non-hormonal also.
So it can benefit the entire family and not just
Oh, that's
the
for
ladies,
sure, yeah,
not just
absolutely.
the ladies involved.
Yeah.
And so if somebody out there is interested and wants to learn more and wants to come in, what does a standard procedure? Is it something that takes weeks? Is it months? What's a protocol?
Depending on what technology we're using, we have lasers and we have radio frequency electrical current to stimulate collagen growth and blood supply in the pelvis, and we can also use hormone replacement therapy. And that works, pretty much right away within a few days or weeks.
So there's
to get
choices.
things up.
So if people out there don't want to do hormone replacement and want to go the natural way, this
Yeah.
is something that you can provide for them
Absolutely.
and ease these symptoms and help
Right.
with this whole transition.
Yes.
And that's in addition to everything else that's offered here.
We're really trying to look after the whole patient.
And that's
And-
nice because
and-
you started out with people with new births, and you have,
Yeah.
like you said, you have a
Yeah.
lot of people out there in the community that you've helped, and now they can come back.
Well, and now some of those babies I delivered are patients. That's
They
pretty
are.
special.
That is
So,
really special.
Yeah.
And I am really surprised to see the number of people that you have delivered and
Yeah.
heard about the number of people and met a lot. So thank you so much for being here in our community
Pleasure.
and for providing these services. And we will see you living local.
Absolutely.
Thank
Thanks.
you. Stay tuned for more.